One of the really nice things about Southwest Pain and having a procedure done by the physicians at Southwest Pain Group is that we do offer patients the option of being sedated or even asleep for their procedure. Now, it's not a requirement. For many patients, it offers them the most comfortable experience. The great thing about that is we've been working with the same nurse anesthetist for over 10 years. Having a seasoned, experienced anesthesia provider really makes a difference. It's the little things that really add up ultimately in the total experience and for the patient. And it's the fact that the physician, your pain management doctor, is very comfortable with the anesthesia provider. And we work with great anesthesia personnel. So when a patient comes to our office, they know that they're not going to hurt during the procedure and they're going to be comfortable after the procedure.
In preparation for a pain block with which you're going to have anesthesia, number one is that it should be nothing by mouth for 6 hours.
Okay.
And that includes gum, mints, hard candy, anything. Other than that, pretty standard stuff. You can take your usual medicines with a few sips of water, and that's about it. A typical pain block procedure would consist of the patient presenting at the office. They do all their paperwork. We bring them to the back. I'd start, or one of my assistants would start a tiny IV so I could administer the anesthesia medicine. They always numb the skin. They're very diligent about that. I've insisted on it. So we try to make everything as easy as possible. After the IV started, we take the patient to the procedure room. We ask them to gently turn over onto their stomach, which is the way we do 98% of our cases. I apply some oxygen, which I put on everybody for safety's sake, some monitors, and when the doctor's in the room, I'm ready to go. I give the anesthesia medicine. You take a very light, short snooze. You wake up feeling like $1 million. If a patient is concerned about a breathing tube for these procedures, they need not be, because these particular types of procedures lend themselves to a deep sedation, and you're breathing on your own, and it's just not needed. Once the doctor is finished with the procedure, we take them to the recovery area, allow them to awaken completely, sit them up in a recliner, let them eat and drink a little, take the IV out, and they can be dismissed. They should wake up feeling like $1 million.